Welcome back. Our next guest says it's the #1 question she gets at the office. What's the difference between cataract surgery and LASIK vision correction?
Dr. Martha J. is here to clear up some of those answers. She's an eye physician and surgeon at Lakeshore Eye Care Professionals. Welcome back, doctor.
Thank you.
Nice
Pleasure
to have you here. Yeah, this is a common question you get, right? So what's the difference between LASIK, vision correction, and cataract surgery?
Exactly. Well, one is for cataracts, so let me bring out my little eye model here. A cataract is a clouding of the lens back here in the front of the eye. So it's behind the pupil, and that's more common in older people. Okay. What happens is the lens just gets...
So point again where that is.
It's right here.
Okay.
The lens gets yellower and yellower as time goes on. So light comes into the front of the eye, gets caught up in this little lens. Okay. By the time it hits the retina back here, it's a blurry image. So that's a cataract, and that's dealt with cataract surgery. LASIK involves the front part of the eye. So the purpose of LASIK is to decrease your chances or your requirement for wearing glasses. So we change the shape of the front of the eye. So you use 2 lasers, one to make a little flap on the surface of the eye, another one to change the shape of the eye so that you don't need glasses.
So typically that's going to be a younger patient, someone even as young as in their 20s?
A 20-year-old might be a little bit too young. What you need to do is wait until your distance correction has stabilized. So it might maybe 7 or 10 years after you've started to wear glasses. So I have operated on people as young as 20, but usually it's maybe mid-20s. You want to be sure that their distance correction has stabilized.
And you've actually had LASIK vision.
I have,
correction.
and it's just marvelous.
Yeah.
This is my first teleprompter experience.
Yeah, she was excited. She's like, I'm going to be able to read.
I'm one of the, why did I wait till I wasn't on TV anymore? But it really has been wonderful. And think about when you're swimming or when you're outdoors
waking up in the morning
in the wind because the contacts dry out so much. And it really was not painful. It was very quick. You have to be willing to deal with a little bit of blurriness initially, wouldn't you say, doctor?
Well, you had LASIK about 10 years ago, I understand. It's changed quite a bit since then. Back when you had LASIK, you probably had a blade to generate that flap at the beginning of the procedure. And now it's a lot safer. It's almost impossible to have a problem with the first part of the procedure where you make that little flap. So when we do it with a laser, we're actually putting little air bubbles on the surface of the eye. So that flap is centered every single time. And even another thing I like about it is that the flap is kind of like a little cork. So when you lift it up and put it back down, it's almost impossible for it to slide from one side to the other. So another couple of things about LASIK versus cataract surgery is LASIK is an outpatient procedure done at a laser center. Cataract surgery is actually done in an operating room, and that's because we actually enter the eye. So what we do with cataract surgery is I make a little opening on the side of the eye, go in and vacuum out that lens and replace it with a plastic implant.
It's kind of making my eyes almost water up a little bit. And I think a lot of people who have, nervous eyes, think that it sounds a little scary, but these are very well advanced and researched procedures.
Oh, exactly. No shots, stitches, or patches with either procedure.
With cataract surgery, how long does it last?
Cataract surgery lasts forever.
Is that permanent?
Exactly. And the newest thing with cataract surgery has to do with the implants. Because when you take that little lens out, you have to put a plastic implant in or you can't see. So in the past, we only had implants to give you good distance vision, kind of like what you had with LASIK. But now we have implants where you can see far away, close up, and intermediate afterwards without glasses. Wow. So actually, sometimes cataract surgery is better than LASIK.
Can you ever be too old for LASIK and too young for cataracts?
Not really. I mean, you could be born with cataracts.
Oh, really?
There are people that little babies that have cataracts.
And the symptoms would be a cloudy vision?
Well, I mean, you can't ask an infant if they have cloudy vision. But you might notice when you take a picture of that infant that the red reflex isn't the same. But typically, cataracts are at an older age. But they do happen younger if you're very nearsighted. So people have real thick glasses sometimes have cataracts in their 40s and 50s rather than 60s and 70s. And as far as LASIK surgery, you can't really be too old for LASIK, but if you have something else wrong with your eyes, you can't have LASIK. So let's say you had cataracts and you had a cloudy lens up in here, there wouldn't be any reason to do LASIK because if you got rid of your glasses, you'd still have blurred vision because you had a cataract. So if you're older and have nothing wrong with your eyes, then LASIK is an option.
I think that's something that's important is that everyone, regardless of how good or bad your eyesight is, to always come and see a professional so that you know exactly exactly what your options are. If you have bad eyesight or any issues, or if they're good, make sure that you maintain that good vision. So I want to make sure everybody has the information so they can contact you, doctor. It's Lakeshore Eye Care Professionals. You've got offices in Mequon and in Saukville. You can visit her online at lakeshorevision.com, and Dr. Martha J. can also be reached at the phone number 262-241-1919 to help you distinguish between LASIK and cataract or any other eye issue you may have. Thanks
And
for
no
being
fear,
here.
no fear.
Exactly. Thanks for
Thank
being
you.
here.